Okay, it's today's skill is unrelated live donor transplant, and there is a patient, Mr. Bowman, who is having type 1 diabetes, diabetic nephropathy, and is now on the renal transplant list. His wife now she wants to donate one of her kidney, and so your task is to discuss the pros and cons of the live organ donation with Mrs. Bowman, with his wife. Okay. So, as in every skill, we are doing introduction, greet, understanding, purpose, agenda. So, like this. Hello, good morning. I'm Dr. Reis, one of the doctor in the diabetic clinic. Are you Mrs. Bowman, the wife of Mr. Bowman? Okay, nice to meet you, ma'am. Well, I understand that your husband is having diabetes and he is on kidney transplant list. Is that correct? Okay. So, I'm here to discuss with you about kidney donation and what we can do further. Okay, okay. So, before I proceed further, will you tell me that what you know about kidney transplant? And it's better if your husband is also here. So, conduct this skill in the presence of better both husband and wife. Okay. So, now take their insight how much they know about kidney transplant and reply their questions, whatever they ask. They can ask many questions, how it is carried out, what are advantages, what are disadvantages, and please listen to all questions patiently and reply questions and within ethics, and keep on adopting silence and try to talk in small chunks. Okay, and keep on taking the insight regularly, so that give as much information as they want to know. Okay, you can explain that live organ donation has a better outcome than a cadaveric donation, and that the matching will be assessed, and the matching need not to be perfect, and it is not vital that the donor should be a close relative of the receiver. This you have to reassure. Okay, because the wife is not the close relative of the husband, that's why she is a little bit worried. And you can tell the advantages that you will remove him from the waiting list, and he will not in the need for the continuing dialysis, and also it will minimize his deteriorating health. Of course, he will have a new kidney and he can live better, he can do better. And also kidneys from the live donor, if like you are donating, they need not to be transported from one side to another, so that kidney will be also in a better position to be transplanted. Okay, and also you will get psychological satisfaction after helping your husband in this way. Now if she asks any risk or any disadvantages, then you have to be very honest. Okay, and tell that yes, there are risks, and now you keep on telling risks, like before there are risks before operation, during operation, and after operation. Okay, so these all you have to explain. And also there is minimal chance that you might develop high blood pressure, and it's a major operation, so you have to stay in the hospital for a week and maybe a few weeks after the operation to have full recovery. And now the psychologically you may feel that you are left with only one kidney, and you have to spend your all life with one kidney, although many patients are doing very well with one kidney, but this psychological impact you might have. And also tell them, also you will go many this you are talking to Mrs. Bowman. Okay, his wife you are telling. So many before operation, don't say pre-operative, this is a jargon. Say before operation you will undergo many assessment, and it may reveal some diseases in you like hepatitis B or any other conditions. And also tell him that you have to take off from the work, and you may lose your earning, and you have to check the implications of organ donation with the insurance as well. Okay, and I hope that no third party interests are involved. So these all risks you have to tell in short chunks, and keep on checking the understanding as well. And also tell that it might be rejected, there are possibilities of rejection as well, and so and the recipient, he has to be on long life medications to prevent rejection. And then you can ask that if they decide to go ahead, if they agree, then they will be assessed by a transplant team and do the end you recap, patient recap, follow up, sports help. And if they don't agree, then you can call them again, or you can give them time to think. Okay, now few things which you should know, that live donor kidney transplantation should only be undertaken once the following criteria have been met. The examiner may ask you, like, the risk to the donor must be low, the donor must be fully informed, the consent must be fully and freely given, the donor must understand that she is entitled to withdraw consent at any time before the operation, the offer of the organ must be totally voluntarily. Okay, and the transplant procedure must have a good chances of successful outcome for the recipient. An independent assessor must have conducted separate interviews with the donor and recipient and submitted a satisfactory report to the HTA. Okay, so like this you have to carry this skill.
Please like, share and subscribe my YouTube channel for more videos. Thank you.